The 2014 Ebola outbreak in West Africa was the largest and most complex since the virus was discovered in 1976. The hardest hit countries, Sierra Leone, Liberia, and Guinea, faced crippling hurdles in fighting its spread, including no quick way to diagnose patients.
It would take 2 or 3, sometimes 4 days to get results back. In the meantime, you had malaria patients in with Ebola patients, and if you didn't have Ebola before, you're likely to have Ebola after.
Images of deserted villages. This little girl found alone in a house with her sister dying of Ebola and a husband watching his dead wife being carried away by undertakers are stark reminders of what the region went through. As the number of Ebola cases was multiplying in some parts of West Africa, thousands of miles away, right here in Utah, a rapid testing kit, which has been in the works for years, was ready to go. Cynthia Phillips helped develop the Ebola testing kit for BIOFIRE defense.
The FilmArray kit is both an instrument that is a diagnostic and a little pouch that's disposable and room temperature stable that you put a human sample in and some water, and then you put it into the instrument and it gives you back results on a whole series of tests or pathogens that you might have in that sample.
It gave us the ability to test patients in 1 hour.
Americans anxiously watched the first Ebola patient arrive on U.S. soil. Dr. Kent Brantley, who had been working in Liberia, was brought to Emory University Hospital in Atlanta. Eileen Burd is Emory's clinical microbiology director and recalls those first days.
I will have to admit, the first time I opened that first tube of blood, knowing what was in there and what it was doing to the patient down the hall was a little daunting. And so it caused me pause, and then you take a deep breath and you do the work you need to do.
Emory Hospital treated 4 Ebola patients, and Dr. Burd says she's reassured FilmArray was among the tools on hand during the crisis. The instrument is one of 7 diagnostic tools the World Health Organization has approved for emergency use. Guinea's Health Ministry Inspector General also is grateful.
Before, we had to transport samples to Dakar, Senegal, or Lyon in France, but today, thanks to our partners in France, the CDC in the US, and many others, we are able to make rapid diagnosis for Ebola.
More than 11,000 people died before the West Africa Ebola epidemic was contained. Health experts hope these new rapid testing tools can drastically lower deaths in future outbreaks. Mariama Diallo for VOA News, Salt Lake City, Utah.